Hello everyone, this is Dr. Shaher Khan. I'm a board-certified plastic surgeon focusing on explant surgery. I want to go ahead and highlight of what we hear recently in early part of September, where a group of UCLA doctors and scientists were coming up with a test to detect for silicone implant rupture and to detect the particles. We know clearly patients who have intact silicone implants and also ruptured implants basically have this gel bleed phenomenon. We also know of patients with intact saline implants who have the same sign symptoms of those patients that have ruptured implants, and also intact silicone implants where you have this gel bleed phenomenon that occurs. And there is no point in testing or detecting a rupture because this gel bleed phenomenon occurs in the vast majority of the patients who have intact implants, especially saline. And we know of this study that I did with Dr. Dijkman, where I sent the implants, saline implants, from a patient here in the US via FedEx to him, and he centrifuged the saline within the saline implant, and the centrifugation occurred for an hour at 11,000 RPM, and a sediment was collected at the bottom. And this sediment was evaluated and studied by electron microscopy only to show what were silicon particles. We also know of this study by Dr. Mehta of a patient who had intact saline implants, and she had what were these ground glass opacities within the lung tissue itself, consistent with what is the silicone that was gel bleeding, leaching out of the intact saline implants. So there is no point testing for silicone rupture because this gel bleed phenomenon occurs in patients with intact saline and intact silicone implants, and certainly a whole lot more in patients with ruptured silicone. Breast implants are bad. They are not healthy. They are associated with this, quote, leaching phenomenon or the gel bleed. And this is precisely why there should be no test to detect. Certainly, if they can detect in microscopic levels these patients who have silicone within the blood, that certainly will add to the physiology as to why the patients are hurting. Certainly in patients who have intact implants and who have these silicone particles that are going to be picked up via potentially mass spectroscopy, for example, or electron microscopy, and if there is a test that can detect the silicone within the blood, especially in those patients with intact silicone or saline implants, that will only add to the evidence that clearly we show clinically from the biopsies of these patients who have had these analysis, be it in the lymph nodes or in the spleen, for example, or in this case, the patient with the lung tissue that was biopsied by Dr. Mehta, where we clearly show that the silicone has leached out, and hence this is what is the culprit in behind this breast implant illness and the toxicity that it causes in the various organ systems, essentially all organ systems of the body. So hopefully you found this informative. Please share, and I will go ahead and attach those links with Dr. Dijkman so you can further look into this. This is Dr. Khan, Executive Plastic Surgery.